Hello, I'm Jesus Garcia, and this is our presentation on foot injuries. My foot injury was the turf toe. The big toe is made up of just two joints. The largest of the two joints is called the metatarsophalangeal joint, otherwise known as the MTP joint. The MTP joins together the first long bone, the metatarsal, and the first bone of the toe, the phalanx. When an athlete suffers from a turf toe injury, it is the MTP joint that is injured. The turf toe injury. The definition of turf toe is sprain of the MTP joint. It occurs when the big toe is forcibly bent into a hyperextension. In most cases, it's when an athlete pushes off into a sprint and the toe gets stuck flat on the playing field. These sprains to the big toe joint become widely conventional in American football players, since most playing fields have been switched over from natural grass to artificial turf. Artificial turf is a lot harder surface than grass, which doesn't give as much as when a force acts upon it. Diagnosis. The MTP joint is surrounded by important structures that hold it in place. Together, these structures are referred to as the plantar complex. Plantar plate, a fibrous tissue that prevents the big toe from bending too far. The collateral ligaments connect the phalanx bone to the metatarsal, which prevents the toe from stretching too far side to side. The flexor lucus brevis is a tendon that attaches the metatarsal bone to the phalanx, which provides strength and stability. The sesamoids are two small bones found in the flexor lucus tendon that to help move more freely and help to bear the weight placed on the forefoot. A turf toe injury refers to any soft tissue damage occurring in the plantar complex. There are three different grades of a turf toe injury. Grade 1 is when the plantar complex has been stretched too far, causing pinpoint tenderness and slight swelling. Grade 2 is a partial tear to the plantar complex, causing a lot more tenderness with moderate swelling and bruising. The toe itself is limited to movement and very painful. Grade 3, the entire plantar complex is torn, in which case causes severe tenderness, swelling, and bruising. The big toe is almost impossible to move without causing extreme pain. Treatment. Non-surgical treatment, grade 1, requires the athlete to follow the RICE protocol: rest, ice, compression, and elevation. Taping the big toe to other smaller toes helps restrict its motion. Grade 2 calls for the MTP to be immobilized, in which a walking boot may be helpful for up to a week, following the grade 1 treatment afterwards. Grade 3 is for far more severe injury, which in most cases asks for the toe to be completely immobilized for several weeks. A cast or boot is prescribed for several weeks until the injury heals. Surgical treatment. Surgery is not often necessary, but in some cases that surpass the level grade 3 injuries, doctors more often than not recommend it, especially when symptoms persist or the level of athletic play is affected. Injuries such as a severe tear to the plantar complex, fracture of the sesamoid, vertical instability of the MTP joint, loose bony chip in the joint, damage to cartilage of the joint, or new or worsening bunions. Now I'm going to pass it out to my partner.
Hi, my name is Samara Hernandez, and my presentation will be on the anatomy of the plantar fasciitis, as well as the rehab, the diagnosis, and the injury itself. So the plantar fascia, which is also known as the plantar aponeurosis, is a white sheet-like band of strong fibrous connective tissue. It also resembles a flattened tendon or ligament that connects the bones and tissues on the sole of your foot. It is kind of like a rubber band that loosens and contracts when you move. It stabilizes the medial and the lateral arches of your foot and is used in the takeoff phase of walking and running. So the inferior anatomy of the foot, the plantar fascia originates from the medial calcaneal tuberosity, which is right there at the bottom. It forms a longitudinal arch by moving across the bottom of the foot and extending around the ball of your foot, then attaching to the base of your toes. The overlaying fat pad covers the plantar fascia and aids in shock absorption. So injury to the plantar fascia is known as plantar fasciitis. So what is plantar fasciitis? As per the American College of Sports and Medicine, plantar fasciitis is the inflammation or damage to the most important ligaments of the foot, the plantar fascia. what happens to the plantar fascia of a person who suffers from this injury. So your plantar fascia is meant to spring with every movement made. However, a person with this injury will have a plantar fascia that moves in excess, which would result in small tears that cause a painful inflammation. As well, other probable causes of plantar fasciitis are the use of worn-out running shoes, excessive running on hard surfaces, sudden increase in training mileage, weight, and the neglect to stretch the calf muscles, which all these can result in a tear in the plantar fasciitis. So pain correlated with plantar fasciitis is pain 4 centimeters forward from your heel and is tender to the touch. Painful first steps in the morning and pain after sudden stretching of the sole of the foot. It is very common in all sports, but mostly in runners. Joakim Noah, a basketball player for the Chicago Bulls, described it as having needles pressed upon the bottom of your foot. So the diagnosis for plantar fasciitis is usually a physical of the foot performed by a physician, which is suffice to identify the pain near the heel. However, if nothing results from the physical, the physician may proceed with an X-ray or an ultrasound scan of the fascia. The latter will show swelling and thickening of the plantar fascia, which can be seen right here in this picture. So the rehab for plantar fasciitis includes an extent of exercises, which are these right here, as well as resting from activities, which is usually performed at the beginning when somebody experiences plantar fasciitis. However, if that does not work, usually doctors will refer to the others, which is footwear, avoiding flat soles, or for women, avoiding heels, as well as wearing shoes with good cushioning. And then others are ice massage or cold pack application, taping, medication, which is usually your ibuprofen, of course, prescribed by a doctor, or other anti-inflammatory drugs, as well as orthotics, which include these stretches again. And now, Andrea.
Okay, so I will be presenting the Jones fracture and the injury, the diagnosis, some of the rehab treatments that you can do, and the internal anatomy. The Jones fracture is the fifth metatarsal contains the base, the tuberosity, the shaft, the neck of and the head. Acute and stretch fractures of the metatarsal shaft are usually within 1.5 centimeters of the tuberosity. Soft tissue structures include the lateral band, the plantar fascia, which is here, the peroneal brevis tendon, and the peroneus teres tendon. The previous brevis tendon includes a fan-like across the proximal fifth metatarsal, which is this part. Okay, so the Jones fracture injury occurs in a small area of the fifth metatarsal that receives less blood and is therefore more prone to the difficult healings. The fifth metatarsal would be right here. Symptoms often include pain, swelling, and the tenderness of the outside foot. Difficulty walking, bruising may occur as well, depending on the severity of the injury. Different types of Jones fractures. There's two. The first one is stress fracture, is a tiny hairline break that often occurs over time. So most of the time, you can have the Jones fracture and not even know about it. The second one is an acute fracture, which is often caused by a sudden break. So sudden movement includes any jumping, any weight-bearing activities such as basketball. Some of the causes include overuse, repetitive stress, and trauma to the bones. Okay, the diagnosis for a Jones fracture is most of the patients with a Jones fracture typically have no idea that it is a fracture. Most of the time, it gets confused for a minor sprain. A diagnosis can be made simply by seeing a foot or an ankle surgeon or doctor, and they will ask the basic questions on how the injury occurred and when the pain started. The doctor or the surgeon will then feel around the outside of the area, press gently, and look for any tenderness or abnormalities that seem unusual. Then, if x-rays are needed to see a more in-depth view of what is going on internally, they will be taken. Okay, so any treatment or rehabilitation, most of the time a Jones fracture is regarding a non-surgical treatment. So there's a technique, and it's called RICE. The first one is R for rest, stays off the injured foot. Walking may cause further injury. The second one is ice. Apply an ice pack to the injured area, placing a thin towel between the ice and the skin, using ice for 20 minutes, and then waiting at least 40 minutes before icing again. C in rice is compression. An elastic wrap should be used to control swelling, which is anywhere in this area of the foot. Elevation for the foot should be raised slightly above the level of your heart and reduce swelling. So as long as you keep your leg above to elevate any swelling. Surgical approach is the injury may involve displaced bones, multiple breaks, or has failed to adequately heal. Surgery may be required, but is ultimately up to the patient's doctor and surgeon for the best surgical procedure that is needed. Most of the time, if the fracture is indeed a severe one and it cannot be rehabilitated just on the Rice method or any immobilization of the foot, then the surgical approach is needed, and you can consult with the athlete or anybody that is having a Jones fracture, so that way you can see on what surgery you need. Yeah.
So these are our works cited. In case anybody else desires to acquire any more information on the following injuries, you can go ahead.